Hi, my name is Rebecca Winter. I am the founder of Strong Mama Yoga, and I am here today to speak to you about the pregnancy myth of can a pregnant woman safely lie on her back during a yoga practice? To understand why this is an issue, we need to understand two of the major veins and arteries in the body. First is the inferior vena cava, and the second is the abdominal aorta. So let's take a closer look. This is an image of the lower thoracic cardiovascular system. So let's first get our bearings here on what we're looking at. So here you can see the pelvis. You can see the tops of the hip bones here. So you can imagine that the belly button is right around here. And you can see the kidneys and a cutaway of the intestines. There are two structures that I want you to focus on in this picture. First is the blue vein that we're looking at here, and that is the inferior vena cava. So the vena cava is a vein, it actually splits into two veins that returns deoxygenated blood from the body back into the heart. Then the second structure that we want to take a look at is the abdominal aorta, which is the red structure that I was highlighting right here. So the abdominal aorta is going to supply oxygenated blood to all of the abdomen, the pelvic organs, and the legs. Obviously, two very important structures. They both sit just a little bit on the right side to center of the spine. So if you imagine a baby growing in this area, the uterus starts off pretty low in the pelvis when a woman first gets pregnant in the beginning of their first trimester. And then the uterus is going to continue to grow and grow until it fills up pretty much what feels like the entire abdominal cavity by the time a woman is at the end of the third trimester and ready to give birth. Since the baby does shift and change its position, and also it's important to know that the placenta doesn't stay in the same place either. So the placenta is going to grow in a different place of the uterus for every woman and in every pregnancy. And the placenta grows with the uterus, so it will actually move during pregnancy as well. But the weight of the baby and the weight of the placenta are the structures that we are concerned with when we tell a woman you might not want to lie on your back for a long period of time during pregnancy. So let's look a little bit closer at what exactly that looks like. Here you can see two different pictures of a pregnant woman, first lying on her back, and then the second is lying on her left side. So you'll see that when this pregnant mama is lying on her back, it's showing that the uterus containing the weight of the baby and the placenta is lying directly on that inferior vena cava and abdominal aorta. This is only showing the aorta in this picture, but we can assume that both are being crushed a little bit. Then you see that when the woman turns over to her left-hand side, it frees up that aorta and the inferior vena cava and takes all of that weight off of the spine. So when it comes to sleeping during pregnancy or spending long periods of time in one position, it is recommended that a woman lies either on her left or her right side. You'll hear people saying left more often than not because they want to be sure that the weight is completely off of those two structures. But a lot of women are more comfortable on their right-hand side, and most OBs and midwives say that that's fine as a sleeping position as well. Sleeping directly on your back, but let's talk about that a little bit. So in this picture, you're seeing this woman is probably in her late second to third trimester. So she does have some nice fullness in the uterus, and we can assume that the baby is larger at that stage. So this is a time when you do want to be concerned about leaving a mama on her back for a long period of time. But it's not a rule that every single time a pregnant woman lies on her back, she is going to be putting pressure on those two structures. In fact, depending on where the baby and the placenta are, the vena cava and the abdominal aorta might not be touched at all. So now you've seen what it looks like in two dimensions. let's talk about this more three-dimensionally. So it really needs to be the perfect storm for a woman to be lying on her back and have the fetus and the placenta in the perfect position to put the right amount of pressure on that inferior vena cava and or the abdominal aorta to cause any sort of symptoms in the woman's body. It's really good to know that if you are working with a client or if you are a pregnant woman in your first trimester, you probably don't have enough weight from the baby and the placenta to be able to pinch those structures. As your belly gets larger, as the baby grows, we start to be more concerned, especially the second half of the second trimester and in the third trimester, that we really don't want to be leaving a pregnant woman on their backs for too long. Thankfully, the body has a beautiful feedback mechanism to let you know if you are causing harm. Your body is going to do everything it can do to get you to move if one of those two vein or arteries are being crushed in any way. So if you are a teacher working with women who are pregnant, you want to make sure that you say to them, if at any point you're lying on your back, you feel dizzy, nauseous, start to get sweat, please move immediately. Those are the big signs that you are doing harm and actually causing a loss of blood flow either back to the heart or down into the legs and the pelvis. So thankfully we have that feedback mechanism. The other thing to know is that it's not like a light switch. So it's not that a woman just rolls onto their back and immediately has blood loss. You have time to feel those symptoms and move if necessary. You'll hear that some women never experience these symptoms. They'll be able to sleep on their back comfortably through all of pregnancy. But since most of us, while we're pregnant, experience this at one point or another, it is still very important to know. But the answer to the question of, is it safe to lie on my back during pregnancy, is if it's a short period of time, usually yes. Usually it is actually okay, as long as you're listening to your body for those symptoms. If you get nauseous, if you get sweaty and dizzy, move. And you'll really feel that impotence because it's happened to me before. You'll feel that impetus to get up and move your body. You're not going to want to stay still. All that being said, let's look at some modifications. So when I say that it's safe for a woman practicing yoga to be on their back, there are some things that you're almost always going to want to be flat on your back for. So we practice bridge often in prenatal yoga. Bridge is so wonderful to help tone the legs and the core muscles that help support baby and our back and abs while baby is growing. So this is actually a very safe, safe asana, safe pose for women to practice during pregnancy that also really helps tone those muscles that we want to help support us during pregnancy and birthing. You've also seen in my previous videos when I'm doing inversions that I love doing legs up the wall with women who are pregnant. And again, that is a pose that is generally considered safe during pregnancy, as long as you're not experiencing any of those symptoms that you might be cutting off circulation in the vena cava or the aorta. And then I want to show you my favorite Shavasana position during pregnancy. So I do always say that a woman is welcome to take Shavasana on their left-hand side, and there are some reasons that you might want to do that. So, for example, I had issues with my spine in my last pregnancy, and it was painful on my spine to lie on my back. So I loved taking Shavasana on the left-hand side, and that's always something that you're welcome to do. If you do that, please make sure that you have something supporting your head, like a pillow. And I loved using either a pregnancy pillow to snuggle up with or having a pillow between my legs that ran from the knee down to the ankle and something to hug. So you want about 3 pillows at least, or a pillow for your head and a pregnancy pillow. We love a lot of bolsters during prenatal yoga. But If you don't have the spine issue that I have, or if you're in your first and second trimester or the beginning of the third and you really like taking Shavasana on your back, here's a safe way to do it in all stages of pregnancy. So first I take a yoga block and I can choose the height that I want it at. I usually recommend leaving it at the medium, but some people prefer the higher height. And then I'm going to use a nice yoga bolster, but you can use a firm pillow that you have at home. And then I'm going to take my second bolster, but you can again use just another pillow for this one, and place it under my knees. So I'm going to bring my sacrum right down to my bolster here, and I'm going to lean back. Some women prefer to have another pillow underneath the head. If I had a buckwheat pillow around, I would use that. I love those underneath my head during Shavasana. And then I've got the pillow underneath my knees to help give me some support through my hip and help with my low back. So this position, you're propped up. So the weight of baby and the weight of the placenta, thanks to gravity, is going to be moving more down instead of just back. So it balances out that force. Instead of the force going straight down onto the spine, the force is now going more down into the pelvis. So generally, women are very comfortable in this position for Shavasana during all stages of pregnancy. The other thing that you can do if you want to do more extended work on the back, so for example, I like to do some strap work during my prenatal classes sometimes if my students are having tightness in their legs or want to open up their hips more. So you can use this same position with the bolster and the block, but now they're not on their back. And now you can do those more extended leg poses and have them really taking their time and breathing through it and not worrying that you're going to be doing anything to compromise that blood flow around the body. And then the other thing that you can do if you really want to do a pose that is lying flat and is also maybe restorative, so you're going to be holding it a little bit longer, is to put a wedge underneath the right side of the body. So in this case, I don't have a firm wedge. Some people may have those handy, but I do have a nice thin blanket. So you can use a thin blanket or you can use a rolled up towel or even a small pillow. So you're not looking for a lot of height. You're just looking for about 2 to 3 inches here. And then you have your student or yourself lie on your back and just prop that underneath the right-hand side. So that's going to angle the torso just slightly to the left. So again, we remember that abdominal aorta and the inferior vena cava are a little bit on the right side of the spine. So this way that weight is shifted just a little bit off center. You also do need to keep in mind that now you are a little bit off center or your student is a little off center. So the pose that you're doing, you just need to make sure compensates for that. But so those are two really good options to allow some supine poses, which without having someone lie completely on their back. But again, don't be nervous if you're doing a quick pose that your student or you are just going to be in for a couple of minutes. Don't be worried about lying on your back. Your body is going to tell you if you are putting any pressure on that inferior vena cava or the abdominal aorta. I hope that this video was helpful for you.